Gonstead Chiropractic is one of many different types of techniques in chiropractic. The reason I chose to do Gonstead was, as a child, I had a lot of low back pain, especially playing a lot of tennis. And so I didn't have anyone look after my back. The only thing I had was massage. Over time, I went to university, and that was when I was first exposed to a chiropractor. The chiropractic technique that the chiropractor was using was Gonstead Chiropractic. The whole period after that, I was heavily into Gonstead Chiropractic. The reason why I chose Gonstead Chiropractic is because, one, it's very, very effective. Two, is that there's a lot of specificity. So what we mean by that is we're highly trained in terms of looking at and locating where the subluxation is. And so we use numerous types of analysis to make sure that we're trying to give the patient the best care. One thing that we use is this here. It's called the nervous scope. One reason why we use a nervous scope is that, for example, let's say that there's a problem on this area, on this vertebra here. The nerve coming out from here can be swollen up. The nervous scope is a very useful tool for us as we run the instrument down the patient's neck through here. The needle here, if it flicks to the side and comes back over a certain area, that will usually indicate that potentially there's a subluxation there. And we need to look at and hone in on that area when we do motion palpation, indicating we may need to adjust it. So as we run it all the way down, we get a quick guide of potentially where we need to really focus on later when we do the motion palpation. Another reason why I chose Gonstead Chiropractic is because of the X-ray analysis. The X-ray analysis is highly developed by Dr. Gonstead himself. Okay, so X-ray analysis is very crucial for our analysis of a patient. So depending on how the pelvis, for example, has misaligned, it will indicate potentially what's going to happen up the rest of the spine. In terms of Gonstead Chiropractic, where we adjust is going to be, in many cases, different to other chiropractic techniques. For example, a lot of chiropractors will adjust up into here, especially upper neck. Okay? But a lot of times, these are compensations for what is happening below. So looking from X-ray analysis, looking from using the nervous scope, also motion palpation of the patient, we can locate which area is restricted. Okay, and looking from the nervous scope, if it tells us that yes, there's most likely nerve pressure on this level through here, even though the pain may be coming from here, the patient's saying that the pain is upper neck, there's always pain up there, they can't move the neck very well, even though there may be stiffness and a lot of swelling there, a lot of times it can be because of underlying problems lower. So where we adjust is in many cases a lot different to other chiropractic techniques. Same with the low back. So, for example, someone comes in for a low back pain, especially around this L4, L5 area, which is very common. A lot of times, this can be compensation for what's going on in the pelvis.